I'm Dr. Craig Joseph.
And I'm Dr. Jerome Pagani. And this is Doc Talk.
We only have to look around to see that people are living longer. From now until 2030, 10,000 baby boomers in the United States will turn 65 every day. By then, 1 in 6 people in the world will be age 60 or over. This is great news and represents a real triumph of modern medicine. Data from the CDC show that 78% of Americans aged 55 or older have at least one chronic condition. A Nordic analysis of CMS's data shows that roughly 65% of Medicare fee-for-service beneficiaries have at least 2 chronic conditions. More troubling, 54% of adults aged 18 to 34 years have at least one chronic condition too, meaning the trend of chronic disease will continue growing.
Care coordination becomes even more important as health needs become more complicated. We aren't doing this particularly well, as was shown in a 2022 study that found that 42% of older adults receive poor care coordination. Affordability is also paramount. The cost of care for both routine and unanticipated health events can lead to people outliving financial resources. The need for long-term service and support, for instance, is highest among those in the bottom quintile of lifetime earning. Mental health is another gap that needs to be addressed. About 20% of those over age 65 can expect to have mental health issues. Loneliness contributes to this concern. More than a third of those age 45 or older report feeling lonely, and a full quarter of those over 65 meet the definition of social isolation. This is just a sample of the issues that need to be addressed to support older adults.
The cost of healthcare as we age, including assisted living and skilled nursing facilities, is prohibitive for much of the population. Other viable strategies are needed to ensure that our aging population stays socially engaged and has a good quality of life, not just longevity. Aging in place is one such approach. Some older adults will need attentive in-home care, while others simply want to stay where they are. For both, care plans that include a combination of remote patient monitoring, wearables, and telemedicine offer the chance to expand the level of care people can have at home, as well as the geographic footprint a health system can support. Technology can also bring people together when it's deployed in a way that supports positive social interaction.
The overarching socioeconomic, psychosocial, and population health statistics for older adults, as well as the increasing receptiveness to technology in that age group, opens the door to the technologies and services that support a decentralized care approach for older population. And the good news is that research shows aging Americans are more willing than expected to learn technologies that connect them to healthcare. The ability for more frequent touch points as people age is merging with the growing tech literacy among older adults, the trend of health consumerism, and the maturity of equipment, infrastructure, and care models that will support the needs of older people. More than ever, this makes a click-and-mortar strategy important for a healthcare enterprise that will be supporting healthy aging for an increasingly long-lived population.
This AI is really cool.
I've heard physicians are using AI to help out with documentation.
Actually, that's a great idea, but I just use it for running errands.
We talking about ChatGPT?
No, I use Aaron MS3.